What we've learned about so-called lockdowns and the COVID-19 pandemic. COVID-19 has turned the world upside down and challenged everything we thought we knew about pandemics and lockdowns. In this video, we'll take a look at what we've learned so far and what it means for the future. A review of the evidence on lockdowns as a public health measure. The evidence on lockdowns as a public health measure is undeniable. They have saved countless lives. The impact on mortality of countries that adopted nationwide lockdown strategies or extensive stay-at-home measures has been shown to be significantly lower than in nations with fewer restrictions. A conservative estimate of the effectiveness of such interventions holds that half of the cases and fatalities associated with COVID-19 could have been avoided in countries with some degree of lockdown and social distancing. What's more, recent research indicates that economizing interventions can result in a heavier cost in terms of lives lost, proving the necessity of adherence to public health guidelines. Ultimately, by implementing a comprehensive set of public safety regulations quickly and efficiently, we can go far towards containing the pandemic and protecting our populations. The impact of lockdowns on mental health and well-being. It is well documented that lockdowns have had a significant impact on mental health and well-being. The disruption they cause to routines, the stress of potentially being unable to financially provide for oneself or one's family, and the forced isolation are all key drivers in its effects. Research has outlined that depression and anxiety have risen dramatically, with medical professionals consistently overburdened by an influx of new patients with these issues who may not have been previously known to them. Furthermore, many individuals who experienced pre-existing mental health issues prior to the pandemic have reported an exacerbation of their conditions, potentially leading to more drastic outcomes, such as suicide and self-harm. While governmental support is available for those most directly affected by lockdowns, it is clear there needs to be further psychological provision at a mass scale in order to protect future generations from increases in mental illness stemming from the impositions of global pandemics. The economic cost of lockdowns. Lockdowns created the necessary space for stretching medical resources to help manage the worst of the COVID-19 pandemic, yet several economic costs were incurred. Unfortunately, these lockdowns proved burdensome for many businesses worldwide that rely on day-to-day operations and customer turnover to stay afloat. Numerous studies have already documented the economic losses suffered by various industries, including tourism, hospitality, entertainment, and retail. Furthermore, millions of individuals have been forced into unemployment and poverty due to job loss as well as lack of Social Security payments and other welfare programs. Although it is still too early to accurately calculate the overall economic cost of the COVID-19 lockdowns, one thing is certain: they have exacted a hefty price from society in its efforts to contain this global crisis. The effect of lockdowns on social interactions and human connection. Lockdowns implemented in an effort to contain the novel coronavirus have hindered human connection in drastic ways. As physical distancing measures limit the number of people that can gather together in one place at one time, many people are experiencing a disconnect from their usual social lives. Despite the concerted efforts of governments and citizens alike to embrace virtual social interaction via video chat and digital connectivity, studies show that this type of interaction does not provide the same psychological benefits as direct interpersonal connection. In these unprecedented times, it is more important than ever to be mindful of our need for human contact and to find creative solutions to stay connected despite any impediments from lockdowns. Are there alternatives to lockdown measures that are more effective and less harmful? In response to the COVID-19 pandemic, governments around the world have implemented various forms of lockdown measures. Such steps add to the economic strain felt by many, as well as bring with them other issues such as mental health problems. With an ever-growing list of harms posed by lockdowns, it pays to ask, are there any alternatives that are more effective and less harmful? Absolutely yes. Contact tracing, through apps or phones for one, has had considerable success in East Asian countries like South Korea and Taiwan. This has been combined with selective quarantining of relevant individuals without impacting large sections of societies or economies. Source-focused interventions have also showed promise in certain European countries. It entails efforts to protect vulnerable groups rather than geographically broad shutdown of entire sectors. Finally, non-pharmaceutical approaches such as social distancing voluntarily combined with frequent tests for everyone throughout a community may act as a bridge before eventual availability of vaccines or treatments. Ultimately, every situation is different and calls for tailored situations to curtail infectious transmission without becoming too burdensome on society. The data is clear. Lockdowns work. They are an effective public health measure to slow the spread of a pandemic, and they save lives. The cost of a lockdown is high, but it is worth it to protect our mental and physical health and well-being, as well as the lives of others. The next time someone tries to tell you that lockdowns don't work or that they are bad for you, remember the evidence and stand firm in your convictions.